Assess the scene for safety. Check for responsiveness. Tap the shoulder and shout. A child who is responsive is one who moves, speaks, blinks, or otherwise reacts when you tap him or ask if he's okay. If there is no response, shout for help and call 911. If you are alone and have a cell phone, call 911 and put it on speaker mode. If you are alone and you do not have a phone nearby, after 5 sets of 30 compressions and 2 breaths, leave the child and call 911 and get an AED if available. Check for breathing and signs of life for 5 to 10 seconds. Begin CPR if your child is pale, gray, or blue in color, not waking up, not breathing normally, or gasping. Gasping may appear forceful or weak and may happen at a slow rate. Place heel of one hand on the center of the chest. You may use 2 hands if unable to push down deep enough. Give 30 compressions to the chest. Push hard and fast. Compress the chest about 2 inches at a rate of 100 to 120 compressions per minute. After each compression, allow the chest to return to normal. Give 2 breaths via the tracheostomy tube using the Ambu bag or self-inflating bag. Watch for chest rise with each breath. Recheck for signs of life after 5 sets of 30 compressions and 2 rescue breaths, or if child's condition changes at any time during CPR process. If no breathing or signs of life, continue CPR until help arrives. Reassess need for CPR every 5 sets. If at any point during the CPR process your child needs to be suctioned or trach changed, please perform task and continue with CPR as quickly as possible. Oxygen may be used when providing CPR if easily accessible. Do not delay CPR to connect to oxygen source. If an Ambu bag is unavailable, you may give breaths using your mouth on the tracheostomy tube. If you are unable to replace the trach tube with the same size trach or one size smaller, cover the stoma with your hand, gauze, or clothes and give breaths via mouth to mouth. When giving mouth to mouth on a child, pinch the nose and place your mouth over the child's mouth and give breaths.